Hey everybody, Dr. Schultz with the Centeno Schultz Clinic with another weekly update. Thanks for checking in. We're continuing our series on the thoracic spine. And today in particular, we're going to be talking about the symptoms associated with thoracic disc injury. So thank you for checking in and let's get started. So what in the world is a thoracic disc? It's basically a cushion that's situated or sandwiched between the vertebral bodies. There's a disc at every level of the thoracic spine, and it basically functions as a shock absorber. So it's a pretty important structure in the spine. So let's talk briefly about the anatomy of a thoracic disc. And it's depicted here to the right, but it's very important that we get the two components down. There's two, the first of which is the nucleus pulposus. That is basically the gelatinous center. And then it's surrounded by the annulus fibrosus. This is the strong sidewall that contains it. So again, this is the nucleus, and then a really strong fibrous container that holds it in. I also want to put some orientation here. Here is posterior, here is anterior, and the spine protects this. Now, immediately behind this is the spinal canal. Inside the spinal canal is the spinal cord, as well as the exiting nerve roots. So let's see what happens with a thoracic disc herniation. Basically, the soft gelatinous tissue gets pushed backwards into the spinal canal. Ouch, that really hurts. But let's find the consequences of it. So here we go. As the disc material pushes backwards, it can compress the spinal cord. It can also compress the exiting spinal nerve roots. And it also can create enormous inflammation and spasm because the material that is being pushed back is incredibly inflammatory. So what are the symptoms associated with thoracic disc herniation? Obviously, there's pain. The pain may be localized, but it also can radiate and actually be missed in the diagnosis. It can go across the chest wall. It also can go to the abdomen because of the spinal nerves that are affected. It also can have radiating pain. The radiating pain can go up and down the arms. This is called a radiculopathy, and it's due to the pressure on the spinal nerves. Patients also may have symptoms of numbness and tingling. You know, if you've been outside too long skiing or snowboarding or sledding, that weird sensation that you have in your fingers and your toes, that's what patients can experience with the thoracic disc herniation. They also can complain of heavy legs or stumbling or difficulty walking. So very few people think about the thoracic disc herniation with this, but it must be on the differential diagnosis. And then, unfortunately, some patients can have loss of bowel and bladder function as a result of a disc herniation in the thoracic spine. So what are the treatment options? They vary depending upon the location of the disc herniation, the size of the disc herniation, and the symptoms associated with that patient. So here they are. Conservative therapy, when appropriate, should always be first line. That includes massage, physical therapy, chiropractic care, safe safe anti-inflammatory medications like fish oil and turmeric. Also, medication, pain medications, opioids, also nerve medicines like Lyrica or Cymbalta if there's radicular pain. And then those patients that have failed conservative and medication therapy, unfortunately, sometimes require surgery. And this is what we want to avoid if at all possible. The picture here to the right is basically some hardware associated with a fusion. A fusion is where they take out a portion of the disc, then they put in an implant or bone, and they fuse that segment. Unfortunately, that's associated with significant problems, including adjacent segment disease. Treatment options for thoracic disc herniations are oftentimes difficult in your local community. Why? Because thoracic spine disorders are poorly understood. Thoracic spine anatomy is enormously complex because not only do you have the spine, but you also have the ribs coming into the spine, And then the entire thoracic cage, which includes very many vital structures, which include the heart and the lungs. So when injecting in this area, you need to be an absolute expert because there can be significant complications, such as dropping a lung. And when that happens, if severe, it can have cardiac implications and may require a chest tube. Not a good day for anybody. At the Centennial Schultz Clinic, we are experts in the evaluation and management of thoracic pain. We are all board certified, fellowship trained physicians. All procedures in the thoracic, cervical, and lumbar spine are always performed under ultrasound or x-ray guidance. Treatment options for thoracic injuries, including disc herniations, include bone marrow concentrate and PRP. Thank you so much for your time.